Nephrology are kidney diseases or people that need kidney specialists for a multitude of reasons, sometimes development of chronic kidney disease and trying to find out why that happened. Oftentimes people are sent to me to try to discover why they've had kidney issues and why their kidney function is changing. Also take care of a host of electrolyte disorders, as many of those things are handled in the kidney. Sometimes people with just urinary tract infections, all different sorts of things, genetic disorders. Sometimes people are sent to me just for help with blood pressure control, as almost all the agents work in the kidney themselves to help with blood pressure. When I was in the military, out of high school, I kind of went into, basically I went into communications. It was a 31 Romeo, and during that time I got exposed to a lot of different fields and got to cross-train in some things and got interested in like doing some of the self-training and combat medic, that sort of stuff. And it kind of sparked my interest in medicine itself. When I got out of the Army, I went back home. My family had a air conditioning company my uncle was running, and did air conditioning and heating for a while, and then slowly started putting myself through college, and then ultimately decided to specialize in nephrology. Came down here to interview and fell in love with the place, and so here I am. As someone that's been in several dialysis units, oftentimes they're in strip malls or they're in buildings where there's not a lot of windows. All the patients are in a very confined space, staring at each other. And the good thing about this design for the new building is everyone will be in their own space, facing a glass wall of windows, and get to look out at nature and have a very open concept with a lot of state-of-the-art equipment. Other than just the in-center, we're hoping to have a very large home dialysis training area, and then also allow patients that are in need of peritoneal dialysis and home dialysis to have a place where they can come, have a machine that's easy for patients to use, both on the peritoneal dialysis and the hemodialysis side, so that we can have a successful home dialysis program, which I think is very important, especially in a community where people are working, would like to continue to work, have that autonomy, be at home, and live their normal life without having interruptions with going to the dialysis center during the day, 3 days a week. The hope for me is always to prolong kidney life. And so we have a lot of therapies now, a lot of medicines that we can use, depending on what disease they have, to try to prolong kidney life. We obviously never want to put someone on dialysis, and so catching things early is very important. We have a very large diabetic kidney disease population, and so trying to get people on the appropriate medications to prevent progression of chronic kidney disease is what I get very excited about, because if I can keep someone off of dialysis with medications and changes, that's what I love to do.